Hello, I am here to present to you my capstone presentation from the doctorate in acupuncture and oriental medicine with a specialty focus in healthy aging and longevity from Yosan University. I just have completed the doctoral program and my capstone project. And this presentation was part of the capstone defense that took place in August. And I thought I would put it together in a recording so that anyone who couldn't make it, who is interested in learning more about this research, could find out and tap in with that. So the doctoral capstone from Yosan and in general in our field is designed so that doctoral students can conduct and generate research that will be novel and a benefit to our field at large. So this is the field of traditional Chinese medicine and medicine in general. And in my particular case, it also involves the field of sound and sound therapy, music production. So I hope that you enjoy this presentation. And if you have any questions on any of the concepts or content, please reach out, and I would like to connect with anyone who's interested in the research in this realm. So I'll go ahead and set up the slides here and we can get started. Okay. Hello, my name is Celeste Rose Hoovener. The following is my doctoral dissertation presentation for my capstone project, a study in a novel electronically produced TCM-based sound therapy for affecting mood and perceived wellness in adults. This capstone embarks in the research and development of a traditional Chinese medicine-based sound therapy, or TCMST, through designing, creating, and testing a novel sound therapy intervention. This topic is of great importance as sound permeates all of existence. This project could help provide a means to further understand and intentionally engage sonic nature. In today's society, sound is not being acknowledged or regarded effectively in considering its impact. This leads to many shortcomings in societal constructs and medical treatments that are available. A study of early China's philosophy of and regards towards sound, as well as developing TCMST, may help improve this situation. While today there are many forms of sound therapy being researched and utilized in practice, this modality of TCM-based sound therapy has yet to be introduced or integrated into healthcare. As a lifelong musician and performer who has practiced TCM for over a decade, I am passionate about music and medicine. This photo is one of the many creative arts productions I've been a part of. Here I am with my collaborators performing our original production. Through many diverse experiences such as these, I have witnessed the power of transformational music and arts. And I have also developed in incorporating this into my healing practice and music production work. So my personal interest is to learn and engage with the public through this study in hopes of improving as a practitioner and a musician, and to assist others in realizing their desired health outcomes in clinic and out. So here we go. First, this study overviews a body of literature that provided a theoretical framework that informed the production of a novel TCMST intervention. The intervention was then pilot tested and brought to trial to investigate the effect of participating in a TCMST session on mood and perceived wellness. This study also explores the feasibility of trialing this therapy through an online and remote platform. The alternative hypothesis of this study is that TCMST has an effect on participant mood and perceived wellness, with significant change in mood state measurements, and will be significantly greater than the theoretical average that was calculated. The null hypothesis is that it does not. So by integrating medicine and music texts from early China with modern sound therapy research, a targeted synthesis of TCMST literature was initiated through this capstone. Societal developments from early China demonstrated the correlation between music, medicine, and emotion. Even as shown in Chinese character for Yue, meaning music, or Lei, meaning joy, is contained in the character for Yao, which means medicine. The instruments of early China demonstrate great musical technology and knowledge, notably through the musical scales. Pictured here are the bronze bells of Zhang, which are well over 2,000 years old and still playable to this day, giving us an explicit account of the actual pitches used in the ancient scales. Pitch standards were of the utmost importance, as their impact on the empire was known to be great. These instruments and the music that was played through them were revered as a link for humanity between heaven and earth. The virtue and rightness of any musician could be determined through this playing. Determined by many, especially Confucius, as you can read about in the Book of Rites and the Book of Music. So here, the fundamental TCM theories, many of the fundamental TCM theories correlate with aspects of modern sound science and music theory. The concept of qi is similar to the modern concept of a sound wave, as the frequency of an energy particle transmutes through various speeds, such as from sound into color in 40 trillion times the amount of hertz. Qi transmutes through phases as it increases or decreases in its cycle. As this occurs, it can be, the qi and the sound can be characterized by specific properties and correspondences. Notably with musical tones, the acupuncture meridians, meridian flow, the colors and emotions. That is, that qi can be correlated with these things as well, as everything corresponds and interrelates. So here we have the Tai Chi is the supreme ultimate. It is the balance of yin and yang. And this theory can be applied through different musical ways. For instance, amplitude, through pitch, or the key that you're in. And these are my theories, or my ideas about how it could be applied. It's up for further studies. So the 4 images can be considered in regard to chord progression or resonance, perhaps other ways. And the 5 phases or 5 elements, however you think of it, can correspond with the pentatonic scale, definitely, as well as many other things. And the 6 conformations here can correspond with the chromatic scale, for starters. These are just a glimpse into some of the correspondences between TCM and sound science. And these concepts have yet to be further explored and developed. So early China's cosmology and calendrical sciences knew a lot about all of these correspondences, and they mapped the rhythms of life on Earth in a system known as the 12 earthly branches and 10 heavenly stems. So TCM details how this system is mirrored within the human body. And this model provides correspondences between musical frequencies and acupuncture meridians. As shown here, we have each of the 12 notes of the chromatic scale correlate with one of the 12 meridians. The sequences of the 12 organ clock, where chi enters and expresses within a particular meridian and organ pair according to the time of day. And I will play for you the 12 tones. But I do want to bring up for you an image, different image here. Okay, so here you can see that this is the chromatic scale. That's the circle of fifths. I'm referring to this image here. All right, so bring on the sounds. And move the new share so I can share the sound. So those were the 12 tones of the chromatic scale as they are heard in the bronze bells of Zen. So that was synthesized on a computer software program, and we'll get more into that in a bit here. Back to the presentation. Optimum health in TCM is realized when one's meridian and organ chi is in balance, harmony, and resonance with the rhythms of nature. Yang Sheng in TCM is the concept of nurturing life or cultivating chi through virtuously aligning with these rhythms of nature. Yang practices are vast and include mindfulness, breath work, and gentle movement exercises. The 6 exhalation practices is one of these. It specifies 6 tones that correspond to the organs within the body. These tones are shu, si, hu, he, chui, shi, and I will go ahead and play these tones for you. I will offer this for the 12 tones.
虚和呼思吹吸。
Next, we'll talk about biomedicine, which offers another lens, another modern day lens into which to view the phenomena of the biological processes within TCMST. Humans possess unique anatomical and physiological properties which allow us to create, receive, and emit sound vibration. The body's potential reaction to sound vibration are as varied as there are sounds. This study focuses on the therapeutic effects of sound on the body, the mind, and emotions, highlighting sound's interactions with the nervous, circulatory, and musculoskeletal systems. Through entrainment, sound can induce brainwave states, which can initiate healing cascades of neurotransmitters throughout the entire body and other healing events. When in oscillatory coherence, the processes and rhythms of the body are in sync and optimized in form and function. This can be considered a state of balance, harmony, and resonance from a biomedical perspective. So, in conclusion, the theory established in this literature review provided a model for TCMST, which incorporates the tones and frequencies that can be used to harmonize qi and blood and to regulate meridian qi to the rhythms of nature. This is the image we want to be. So that could be considered a general treatment rather than a specific diagnostic-based treatment, a general sound therapy treatment. While I do believe this can be applied just as any other TCM tool in a diagnostic-based treatment as well. Yet this is using the Yang approach of cultivating life, and it is more of a general treatment that could be considered alongside a sound bath, a Tai Chi course, that realm. This theory that was used to establish this could be applied in many ways to make many different types of TCM ST interventions. This image represents a fractal model of TCMST that could be applied through space and time in many different ways. For this study, the model was applied in the form of a 30-minute soundtrack, and it served as the intervention for this study. So this slide gives a peek into the creation process that would not have been possible without my past experiences with music production. While early China employed the technology of bronze in TCM fashion, I am using our modern technology by creating the soundtrack with the music production software Ableton 11 Suite with custom synthesizers, which I created, and as well as vocal samples, which I also created. To my knowledge, this is the first time a TCM-based sound therapy has been produced in this manner. All creative decisions were made in respect to the theory as closely as possible. Yet this version that I have made remains to be just one of the many potential versions that could be made. I think in my own personal music making, I definitely would have gotten a little bit, different. But this was a scientific experiment, so keeping it as theoretically aligned as possible. So next is going to be a demo of this study's TCMST intervention, the sound therapy intervention, and it creates 3 10-second segments from different parts of the soundtrack. So keep in mind the actual soundtrack only uses smooth and gradual transitions and does not contain the transitions that are heard in this demo. This soundtrack, also keep in mind, it is designed with bass frequencies, which are not being picked up through, will not be picked up through a speaker without a bass range. So also keeping in mind that while listening to this, the audio is designed to be a therapeutic agent, so maintain caution. Maintain caution. All right here. So let's bump this. So Yang Sheng, breathing, mindset, and posture practices were applied alongside this soundtrack to create a listening guideline protocol in order to standardize the way participants received the therapy while optimizing the possible therapeutic effect. Participants were instructed to lie down comfortably, breathe from their diaphragm, and focus the mind on feeling the sounds and or concentrating on the breath. This study's trial tested the intervention and will be discussed in this methodologies chapter. The trial in this study was pre-approved by the Institutional Review Board of Yosan University, my university. And a mixed methodology approach was chosen for this introductory exploration into this novel TCMST therapy. Due to the constraints and purpose of this capstone project, a quasi-experimental trial design was employed in order to investigate the causality of the outcomes of the intervention based on the relationship of variables within the therapy. In the case of effect, This study employed a pre and post intervention survey design to test effect. A paired t-test was used to determine the significance of the change in participants' mood from pre to post intervention, as measured by the peer-reviewed brief mood introspection scale and the original created by the PI, the perceived wellness scale. And for feasibility, a one sample t-test was used to compare the trial's feasibility marker data to a calculated theoretical average response to see how our participants were able to participate in the trial. The participants of the trial were a non-randomized convenience sample of adults with the availability and ability to participate in the trial. A 90 participant sample was required to conduct a power calculation to determine statistical significance of the data and of the qualitative intervention outcome measurements. Recruitment for the trial included paper and electronic advertisements shared throughout my clinic and university's community. The trial was hosted by myself online. Thanks to Dr. Namin at our school for the Zoom support and this photo from his office at USAW. The trial was 1 hour long and included a brief introduction, pre-intervention polling, the 30-minute sound therapy intervention, and post-intervention polling. After the completion of the trial, an optional question and answer session was hosted by the PI on the Zoom webinar. The Zoom polling was utilized to collect the online survey data from the trial. All of the trial data was downloaded after the trial, anonymized, codified by number, and processed through Microsoft Excel. The quantitative data from this trial was analyzed through a combination of descriptive and inferential statistics by our university statistician, Dr. Linda Deacon. The qualitative data was grouped into themes and sub-themes by myself and with the help of my research instructors, Dr. Rahale Korsan and Dr. Mark Sodders. Thank you very much. This trial provided extensive data for this study. The quantitative data revealed that an overall increase in perceived wellness markers and positive mood markers had, and a decrease was found in the negative mood markers. The pre and post-intervention survey comparisons show a statistically significant improvement in mood and perceived wellness markers. The participants reported experiencing significantly higher pleasant feelings and were significantly calmer, less aroused, and more relaxed after the sound therapy session. A total of 232 individuals registered for the TCMST trial, while only 121 of those registrants attended, and only 108 of these individuals participated in the polls. This means that the number of participants required to reach statistical significance contributed data to the trial. The compliance and satisfaction markers were attested to by the majority of the participants, and the average level of response was significantly higher than the theoretical midpoint. Notably, participants indicated that the experience was enjoyable and easy to participate in overall. The qualitative data from the trial revealed that participants had varied experiences during the session. Many participants reported physical, mental, and emotional healing experiences from the TCMST session in the open-ended feedback. Many participants reported improvements in respiratory, circulatory, and mental function, as well as physical changes such as pain and numbness reduction. Here we have the categories, the themes within the qualitative data in the trial, and we also have the sub-themes here. While most participants reported experiencing pleasing sensations, some reported various forms of discomfort during the sound therapy, and many of which that went alongside therapeutic relief, or the discomfort had led to relief, or the discomfort was something that they had felt that was arisen and led to the discomfort. Some of the music was very pleasing to some, while unpleasing to a very limited amount, but still a few. So most of all, this TCMST was reported to induce states of relaxation for everyone, regardless of enjoyment of the therapeutic intervention or not. It was noted to be effective for reaching a meditative state more deeply and quicker than standard meditation by experienced meditators. The question and answer responses after the trial, especially, and during the trial, especially revealed that participants were interested in learning more about this therapy and getting connected with it in the future. Hypothesis testing led to an acceptance of the alternative hypothesis. TCMST has an effect on participant mood and perceived wellness, with significant change in mood state measurements, and that the overall level of TCMST trial feasibility will be significantly greater than the theoretical average, and it was. So the results of this study have led to implications for the theory, the practice, and further research of TCMST. This study met many of its desired outcome goals while inspiring even more questions. So pull up this other image for you. So the literature review created a theoretical basis for designing the TCM-based sound therapies and eliminated various mechanisms in which sound effects once being utilized. So the intervention was created as a sonic emulation of the tones, frequencies, and rhythms of nature's flow, as we remember. And so by entraining with these rhythms, one theoretically can synchronize and experience a state of balance, harmony, and resonance with these rhythms of nature and well-being that are found in nature. And I believe this theory could be further developed to be included in standard TCM education, as attuning to the natural rhythms are the whole point. So why not do this literally with music? And the results of this trial indicate that this intervention caused an effect, and it was therapeutic in many ways. Many of the therapeutic outcomes seen in this study are congruent with findings found in other sound therapy research. There may be many causative factors for this. Primarily, the tones and the rhythms and frequencies themselves may have been the cause of the effect as the theory suggests. Additionally, each component of the listening protocol could have contributed various therapeutic mechanisms to the intervention. How a participant implemented the listening protocol could have impacted how they received the sounds. Relaxation may have also been a mechanism of the therapeutic outcomes just by itself. In the study, as it indicates that participants experienced a parasympathetic nervous system response, which helps all biological functioning within the body by itself. This outcome could have great implications for this society, as there are many people affected negatively by stress in our society. And a lot of these people don't know how to identify or cope with it. And this can lead to the development of the psychogenesis of disease, or the development of disease from the psyche. This study examined the feasibility of this trial, which showed to be promising as statistically significant data was acquired and the trial generally operated as designed. While there are both advantages and disadvantages of holding the trial remotely, the trial contributed to this capstone research. The implications of this study on clinical and daily practice are vast. Through a standalone or integrative treatment protocol, TCMST shows promise in improving clinical health outcomes. This TCMST could be incorporated into daily Yang-Shen practice to cultivate wellness. This shows potential in helping someone in their daily life to regulate their qi, to access that much needed rest and digest, relaxation, parasympathetic state of being. We need all the help we can get these days to accomplish that, and this is shown to do that. The TCMST model in this study can also be adapted into sound therapy treatments for various specific conditions, with a lot of potential that we're diving into now in our future studies. And I am developing this program to make TCMST accessible and adaptable to suit the diverse needs and interests of patients and practitioners. So TCM treatment comes in many forms. And so by offering effective adjunct treatment modalities, treatment outcomes may be improved. So by offering at-home self-care modalities for patients, patient lives may be improved. This is huge. So there were many limitations present for this research project, and these limitations presented a helpful framework to begin studying the TCMST. The limitations of this study created a platform from which to develop future studies, and also give a realistic picture of what we were able to. Okay, so the Zoom meeting kicked me out. So I'm going to try to pick up where I just left off in the limitations section. So our future studies While I'm especially looking forward to applying what I've created and what I've learned in this study in my future creative works, I'd love to make all sorts of creative projects developed from this, and my creative works have led me to make something like this. But there are many potential further next steps in sticking to the TCMST research and making this a more medical pursuit, even though I do believe that creativity is extremely effective in medical, in some medicine. It can help in adjunct therapies. So that being said, I am currently offering TCMST workshops with Qigong and sound therapy sessions for individuals and groups. I hope to develop the theory and the creation and the implementation of this intervention through this process. I would like to technologically advance this therapy further in the way of software optimized for both practitioner and patient use. So these frequencies have the potential to be applied in other forms as well, such as vibroacoustic or electric stimulation devices, such as eStim. So let's play around with some of these technologies. I'm interested in working with other researchers, practitioners, artists, other clinics or laboratories, wellness centers and studios, and festivals or other events who may be interested in this project. If you would like to stay connected or have interest to participate in TCMST or get involved with developing the program, please do. Here is a QR code, which will link you to my website. I'm happy to speak with anyone who would like to discuss this or future TCMST studies. So the importance of this study. Part of it is that by working with humans' most sensitive sense, our first sense, sound, this intervention could help optimize health outcomes of all sorts. This study proposes a way to integrate ancient wisdom into modern day practice. This TCM presents options for technological advancements to help cultivate health, which will inevitably combat any technological advancements that have degraded health through awareness and usability. The study prioritizes mood and demonstrates how impactful it is for health. And we all know how that may have been overlooked or not prioritized in the past, and we're seeing how much that has to do with health in today's world. So the contributions of this study are that this study gives an introductory synthesis of the ancient and modern research to serve as a platform for TCMST studies, and really standing on the shoulders of all of the greats who have pursued this field and all of the experts who have dedicated their entire lives to just portions of some of the things that we covered in this presentation. So this modality of TCMST shows promise as an affordable and accessible therapy with low to no side effects. As we have seen, there was, if people were able to participate in this and not be charged and had healing experiences. And while some people experience discomfort, all in all, it shows promise. This TCMST offers an initial version of this intervention that can be evolved according to the needs of patients and practitioners, and improved from what it is in the first go round. So in conclusion, the novel electronically produced TCMST was shown to affect mood and perceived wellness in this trial. This study also demonstrated that remote sound therapy could be a feasible way to trial this intervention, while many other ways of testing this therapy exist. Statistically significant research was conducted, while various limitations have been recognized within this study. The impact of this capstone is hoped to contribute to the development of TCM and sound therapy while helping improve health outcomes and contribute to the available therapeutic interventions. There are many possibilities for future research and development for this novel TCMST. Here are my references for just this presentation. These are all references that are in my dissertation paper, which with the index and everything is about 350 pages. And I think that 8 of those are references. All of these fantastic sources that have knowledge about music and Chinese medicine and how it can be applied in the way it has been applied in this study and potentially in other studies. So lots of good things here you can look over and ask about if you have any questions. So thank you so much for listening. That concludes the program, the presentation here. So thank you for watching, and please reach out to find out how you can get involved with this research, or perhaps participate in the sound bath or sound therapy in any way. That would be fantastic to connect. So again, thank you, and